Okay. Good evening, everybody, and welcome to another one of our health awareness sessions at Nivarana. And today we're going to be talking about an important and a very relevant topic nowadays, which is heat illnesses and the different types of heat illnesses. The recent incident that took place in Navi Mumbai came out with some shocking statistics where around 600 people suffered a heat stroke, and there were also a few deaths, and a lot of people had to be hospitalized. So, and in a lot of places, they've also issued alerts to be alert for heat waves and not to go outside during particular times of the day. So, today we have our emergency medicine expert, Dr. Gina Chandy, who is going to be telling us all about heat illnesses, the different types of heat illnesses, heat strokes, heat exhaustion, sunburns, and how to manage them. And hopefully, by the end of this session, we will have an idea about how to possibly provide some kind of first aid to so that we can protect ourselves and our loved ones better from heat illnesses. So, welcome, ma'am, and thank you for joining us today. And
Thank
so, the first question that we have is, what is a heat illness?
Okay, so heat illness is actually a gamut of illnesses. It's not one illness on its own. So, in the background of a high ambient temperature, the various symptoms and signs a patient can have or a person can have, which are manifestation of our body not being able to cope with the heat. So the heat, our body has got these mechanisms to be able to cope. And when those mechanisms are overwhelmed or we are dealing with heat beyond what we can handle, we manifest symptoms of heat related illness. So these symptoms are vary from as simple as just a sunburn to something as severe as what we call a heat stroke.
We'll go to second question. What are the different types of heat illnesses that we can encounter?
So can I ask you right up front that I think everybody I have experienced their own type or seen heat illnesses. So can I ask you, what is it that you've seen with respect to heat related illness?
Heat rashes quite commonly. Then during school, probably few of our batchmates just faint during assembly. Those are the few ones that I've seen before my advent as a doctor. But after that, yeah, very different, which you would be telling us.
Even you urinate, your burning sensation. Hunger pangs, is that heat related?
I think Dr. Gina is stuck because of some network issue.
Yeah, I think we've lost her.
Oh, yeah, she's back.
So sorry, the electricity went off here. Yes, so I missed what you said. So you said heat rashes?
Heat rashes, couple of my batchmates fainting during school assemblies, during summers, hot summers. Then, yeah, somebody else.
Yeah, so the spectrum is quite diverse. As simple as heat rash, it could be a heat burn or a heat rash itself. So sunburns are very common when we go out in the sun without anything to protect our skin. We develop sunburns. Then you could have like what we call a prickly heat, usually in our neck or an underarm, our backs, where we sweat more. That's prickly heat, which we technically call malaria, or some people call it a heat rash. Then a little more severe, what we sometimes after a busy day of work or maybe a workout in the heat, when we don't drink enough water later at night or later in the evening, we feel severe muscle cramps. I'm sure all of us have gone through this at least once in our life. The calves will cramp so badly. And then after a small period of time, it'll get better. If you notice you drink a lot of water or like those sports drinks, you feel better, or ORS many people keep at home, you feel better after that. So that's called a heat cramp. The other thing we see sometimes is what we call heat edema. So many of you would notice through summer, you'd find that your legs are swollen. Even younger people, the legs are swollen. So what happens is our body, when it's really hot, the vessels tend to dilate in the skin and in the legs. So because of this vessel dilation, all the fluid or the body fluids and the blood accumulates in the limbs. So you have what's called heat edema. So that's also very common. It improves when you lift your legs. It improves as the temperature comes down. Then there's something called heat syncope or heat fainting. So because of the high temperatures and all the blood is pooled in your legs because of those vessels dilating, the BP kind of comes down because all the blood sitting in the legs. So when you get up suddenly, or you wake up from your sleep, or you're sitting for a while and you suddenly get up, you notice that your eyes black out. That's because all the blood is sitting in the legs and not in your brain. So you suddenly have a fainting like feeling, or you might even faint completely. So that's called heat syncope. Now, a little more severe, you can have what's called heat exhaustion. It can be seen in the elderly, it can be seen in young people after a full day, like a laborer, after a full day of work in the fields. Now, what really happens is because of all the sweating and the salt loss through the sweat, you feel extremely exhausted. So, after a day of work, you're so tired, you cannot do anything. All the muscles cramp terribly, you're sweaty, you're warm, so you can actually manifest a fever. Now, this fever won't be very, very high. It may be sitting at around 102 degrees, 101 degree, and you'll be really tired and unable to do all your day-to-day activities. Now, these people don't become confused. These people don't have a problem with responding. These people will talk to you normally. So that's called heat exhaustion, where the body is not able to cope with the heat. There is severe muscle pain, tiredness, fatigue, but the person will be talking to you normally and they'll be sweaty. Now, that is like the precursor to what we call a heat stroke. A full-blown heat stroke has four main components. The first thing is the high ambient temperature. And then it is seen, secondly, in the second thing is in people who have a problem with dissipating that heat. Now, what is that problem with dissipating the heat? It's either a person who's elderly or a small child whose mechanisms for dissipation of the heat is impeded, or a young, hardworking person whose mechanisms are overwhelmed. So the body is not able to dissipate the heat. So the person will have a dissipation problem, high ambient temperature, then what we call a core body temperature. So everybody should know that sometimes when you go to a doctor or when you are checked for heat related illness, they may check temperatures in your rectum. That is the internal body temperature. So this heat stroke is defined by temperatures, core temperatures of more than 105 degree Fahrenheit. So very high temperatures. And the last thing is that the person's responsiveness will not be normal. It may be as simple as confused talking. The person will talk to you irrelevantly. The person may be agitated. The person may be as severe as having seizures and even be comatose. So sometimes, where do we see this very often? Manual laborers will go to work. Their elderly parents will be at home. When they come back to their parents at home, they will not be They breathe really fast because that's a mechanism to lose the heat. They breathe fast, they don't respond normally, and they'll be extremely hot. This defines a heat stroke, or this is a heat stroke. So this type of a person needs to be rushed to the hospital immediately. So if what I was trying to cover is the spectrum of heat illnesses, from something as simple as a heat rash or a sunburn, then a heat cramp, which is localized, or it can be heat syncope or heat fainting. Then it can be heat related edema or swelling of the legs. And then it can be heat related exhaustion. So heat exhaustion, which I think many of us feel, but we know how to compensate for it. And then the heat stroke, which is a big killer, heat stroke. So this is the different types. These are the different types of heat related illnesses that manifest.
Okay, so for someone who's at home, and like you said, that if someone comes back from a hard day of laboring under the sun or something like that, when do they know that something is minor and can be just managed at home or will get better with time? And when do they have to take them to the hospital? So, what are some of the signs to look out for in people who go out in the sun, or some of the warning signs that we should be aware of?
Can you hear me, Evelina? I can't hear Divya.
Oh,
Divya?
Divya,
Am I audible now?
Yes. I heard it. I heard up to when can it be managed at home, and from when do they need to go to the hospital? Is that what you said?
Yeah, so I was just asking you, like, are there any warning signs that we should look out for, or when do you know that a person is experiencing something which is a little more serious and they need to be taken to the hospital?
So very often, when a person is suffering from heat exhaustion, they would be very, very tired. They will not be able to move around much. They'll be fatigued. They'll be exhausted. The usual things that we do with energy and spunk, they will not be able to do with as much. They'll complain of severe body pain. Now, when you know in a ambient temperature which is high, the person's having fever, so you can do certain things at home. So you can actually give them uh, cold water to drink. You can try to bring the temperatures down. So take them to a cooler room, cooler environment. Um, then you can even put loose clothes on the person, and like with some what we call tepid. All of you would have done in fever, right? Tepid sponging, where you put normal temperature water. You don't have to put cold water on the person, but normal temperature water on the person, and then have a fan to allow evaporation. The best way to get rid of heat is evaporation. So with normal temperature water on the body, if you have a fan running, the water gets evaporated and the temperature of the person comes down. So you can do all these things at home. So when a person's having heat exhaustion, you can ask them to drink a lot of cool water. You can ask them to rest, calm down, just relax, put loose clothing on. You can put some normal temperature water on them and put on a fan, and you can see with that rest whether the temperatures come down, whether the person is able to calm down, that exhaustion improves. Even with heat cramps, when you have a cramp of the leg, if you drink a lot of water and salt based solutions, you tend to get better on your own. The cramp will resolve. So, usually they say over a period of an hour, if you see an improvement, then you don't really need to rush to a hospital with these two problems. But if at any point a person is not responding to you normally, you feel your elderly relative is talking irrelevantly, not talking to you in the normal way, please go to the hospital immediately. If a person's urine is very, very concentrated, sometimes in heat stroke, the urine will become brown because of muscle breakdown. That situation, the person needs to be rushed to a hospital immediately. If the person is absolutely comatose, not responding, sometimes they can have seizures as a part of heat stroke. Please rush to a hospital immediately. So, for all these things, you must take a person to the hospital immediately. Smaller children and older people, the threshold to wait at home should be less. Take them sooner to the hospital than not. And if you have an elderly relative with multiple other diseases, a heart problem, diabetes which is uncontrolled, hypertension which is uncontrolled, and symptoms may be masked by their disease, please take them to the hospital if you feel that they're looking unwell in the temperatures, ambient temperatures which are present currently.
You sort of answered the next question, which said what makes a person more susceptible to heat illnesses. So you've told us about extremes of age and people with other illnesses also. So at home, if you have a small kid or an older amchi or apachin, you have to take care of them in the sense, keep an eye on them and probably go to the hospital sooner. Anything else? Does it have to do anything with fitness of the person? Because you said even people who are working out in a sunny environment also can get heat stroke, right? So,
Yeah. So if you're looking at the group of people who are more susceptible, as you said, the elderly and the young children whose compensation is not adequate. So that group we already know. Then there are not so old people who have comorbidities or other sicknesses, as we said, diabetes, hypertension, heart disease, all of them are at high risk. And there are certain medicines, so anti-hypertensive medications, cardiac medications, even if you have a flu and you take antihistaminics, those like cetirizine and all those drugs, then people who are on psychiatric medicines, all of them are more susceptible to disease because of what the medicine does to your physiology. Now, other than that, the usual people who are healthy and well and who are doing their daily labor as usual in the ambient temperature. Now, there are studies which show that people who have had a recent viral illness, they are more susceptible, even if they're healthy now. Their compensatory mechanisms are not as up to the mark as usual. So people with recent viral illnesses are noted to be more susceptible to heat exhaustion. Also, people with inadequate sleep and inadequate rest and poor eating habits are found to have heat strokes more often. So, in the young, healthy population, these have been noted to be risk factors towards developing a heat related illness.
And in people who are in the older age group, is there something like heat exhaustion which occurs in them even if they don't go out in the sun? And are there signs to recognize that?
So actually the elderly, so there are different ways in which they develop this heat related illness. Some of them, so I've seen old appachans who have gone out in their three-wheelers for a round, met all their friends, come back and then and they've been rushed to hospital. But more often it's them at home because the heat is so high in the houses itself that they're living in. So quite often elderly people may develop heat related illness just in their homes itself because of inadequate ability to maintain cool temperatures in the house. So those are very high risk. So in the poorer population where ventilation is poor in the houses, water is hot, the structure of the house is such that it's not cool, we see many of them presenting with heat related illness. In this setting, I wanted to mention one thing. All old people who present in this summer with very high temperatures or fever are not always heat related illness. We must always, so if you go to a doctor, they might look for other infections. Once they rule it out, only say this is probably heat related illness. So there's a typical spectrum, but we must look. It may be that our grandmother developed a pneumonia, a lung infection, or our grandmother's developed a urinary tract infection. So we have to carefully watch and make sure it's this or that. And usually for the elderly, better to take to a doctor, recognizing what exactly it is.
Okay. So coming to like an important part, which is what precautions should we take to avoid something like this, like a heat stroke or a heat illness?
So, yeah. So at all levels, there are many things that we can do. I'm a doctor, and as a doctor itself, I forget to drink enough water. We never carry water to our workplaces. I'm sure all of you also know, don't carry water or don't drink it because of the so-called busy schedule that we have. So starting from wearing sunscreen to protect our skin, having cool baths to cool ourselves down, adequate ventilation, taking enough rest. So summer is a season where we should rest adequately. So adequate sleep at night, balanced diet, and lots of water intake is very, very important. So we should be drinking and many of us have this mind block of drinking cool water. But actually in summer, that cool water is very, very helpful because it brings down our body temperature. So adequate cool water intake is good when the ambient temperatures are very, very high. Now, with respect to taking care of ourselves, those are things we can do. So adequate rest. If we can maintain a house, if you have an air conditioning, that's great. Maintain the temperatures in a house adequately. Certain things you can do in a house where there is no air conditioning. So the evenings are generally cooler. So in the evenings, you can open the windows up and allow cross ventilation. In the daytime, as soon as the sun comes up, it's good to close the windows and pull the screen so that the heating of the floor doesn't happen and then the ambient temperatures don't go up because of the sun itself. If there is no AC, the other thing you can do is put some water on yourself and allow the fan to cause convection, and that moves out the heat, which is good. The other thing you can do is some houses, Paka houses also, you can put a layer of thatch, which helps maintain the cool. It keeps the cool inside. So that's a very good thing some people do. Other things which can be done is if we don't have, so refrigerated water is a luxury many of us have, but for those who don't have, water can be caught in earthen pots, and that also cools down water and that can be maintained. Smaller children, we kind of think they can tolerate the heat, but we must realize that their mechanisms also cannot tolerate the very, very high ambient temperatures that we're experiencing currently in India. So in that situation, make sure they drink enough water and please give them cold water because it keeps their bodies cool. Don't allow them to play around in the peak of the afternoon sun. Children will play, it's difficult to avoid, but make sure that some things which we can do is wear a cap, cover the head. Even manual laborers, we can advise them to cover their heads because that decreases the heat directly onto the heads. Give them adequate breaks. So the other subset is manual laborers. So I was just thinking, what all can they do? They have to carry water Their restrooms in their workplace should have adequate water facility and, if possible, cool water. They should be able to take a break in the afternoon and adequate diet and hydration at that point. We should make sure they have adequate sleep and healthy diets. And if they have an illness, so sometimes they would want to take sick leave, please allow them that rest, because with that rest, they will recuperate. Working with a concurrent illness will make them more susceptible to a heat-related illness. So these are a couple of things we can do on our own to prevent heat-related illness in our community.
Okay, so the next question is about what is the kind of first aid or the first kind of thing that we can do for a person who has heat-related illness, just a heat rash, anything from there to a child having a lot of high temperature or something like that. So what could we do as first aid other than the measures, precautionary measures we've done? So we reached the point where, okay, so now what do we do?
So in a heat-related illness, so something as simple as a heat rash, it's like a prickly heat. It's because our sweat pores have been blocked. So recurrent baths, wearing loose absorbent clothes so that the sweat doesn't stay on the body, plus recurrent baths and keeping our skin dry after that. A lotion called lactocalamine helps calm the skin and helps it heal too. So a combination of keeping the skin dry, recurrent baths, cooling, and using lactocalamine helps with heat rash. Heat cramps, as soon as you feel that, please sit up, drink a lot of water, if possible, cool water. And you can also have juices with salt in it. That helps relax the cramp. If you rest, usually the cramp resolves on its own. Adequate hydration helps prevent another episode of the same. So quite often, if you're really, really thirsty during your day, it means you haven't hydrated adequately. You've reached a point of thirst. And ideally, you should be drinking enough water to prevent the thirst itself. Once you've reached like a heat exhaustion, that will be a little more difficult to handle because you're really tired. Heat exhaustion, heat syncope, all of those require more hydration. So drink a lot of cool liquids if you're exhausted. Try to keep yourself. So by the time you're feeling heat exhaustion, your temperatures also have gone up. You are sweaty and you're fatigued. So if you could get yourself to a room which is cool, air conditioned, you can change into loose clothes. If possible, even have a bath and let the water evaporate off you. It doesn't have to be a cold bath. Just have a normal water bath and let the water evaporate off you. Then wear like loose clothes, drink a lot of cool water and rest. With that rest, you should get better. With the ambient temperature, if you're able to if you have an air conditioned room and you can wait in an ambiently cool room, you should improve. With this, if you're not improving, please come to a hospital because you need to see a doctor immediately. If anybody is not responding normally with a high temperature, if they are not talking to you normally, if they are drooling from the mouth, if they are seizuring, those type of people have to be taken to a hospital immediately. So in heat stroke, it is proven that if the cooling is done in the first 1 hour, you can prevent a lot of sickness and a lot of death. So taking the patient to the doctor immediately is very, very important. So a person who's not talking to you normally is very, very warm, please change their clothes, put something loose. Don't try to put any water into their mouth if they are not responding to you normally. You can cause more harm than help. You can, if you want, put some tepid cloth on them. If you want, if you can bring them in an air-conditioned vehicle, all that will help bring down the ambient temperature on the way. But don't waste time. Bring them to a hospital immediately.
Also, Gina, what about what can we do? Like if we have a meeting or a mass gathering, what can we do to prevent such occurrences at a larger number? So as organizers or something like that, what can we do?
So having a meeting in the middle of this summer is very, very dangerous. If it has to be done, preferably in the evening hours or the early morning hours, because those are the cooler times in the day. Now, if you're going to build some sort of a shamiana or a cover, thatched cover is good. Something which would prevent ambient heat, a green sheet, those things which bring down the temperature inside, because otherwise those tin sheets and all maintain a lot of warm temperature inside. It's very dangerous. So preferably evening hours after 6 o'clock, if possible, that's a good time. Now, if you're going to have a meeting, it'll be good to supply adequate cold water if in the form of refrigerated bottles which can be handed out, or even earthen pots with water to supply to the people. Fans around the area can maintain some amount of convection and air movement so that the temperatures will come down. But I would still reiterate, keeping meetings in the middle of the afternoon is very, very dangerous. Better to keep it at times which are more safe. Then also we should keep first aider for anybody who collapses at this point. We should keep things which should be, we could use to bring the temperatures down. So ice packs, cold saline, things which have to be kept there in case somebody, even despite our precautions, if something goes wrong.
Oh, so I think you've kind of told us about when to take a person to the hospital. Older people and children should not be kept at home for long if they're not responding. Apart from that, um, if a person is not responding in general after, like, if their ambient temperature is not coming down, even after like tepid sponging and stuff like that, then they need to be taken to the hospital. Is there something else
Yes.
when a person should immediately be rushed to the hospital?
If a person is not speaking to you normally, if you notice the urine is not adequate, if the urine has become brown in color, the person develops seizures, small children who are not able to cope. I guess that's basically the heat exhaustion. Up to the heat exhaustion spectrum, you can manage at home, but the heat stroke and above have to be brought immediately.
Doctor, you've heard of intermittent fasting, which is very popular now with the young generation. So, what do you advise for that during summer months? Is it good to do that fast or not good? What does research say?
So intermittent fasting actually, so in dealing with heat, what is very, very important is hydration. And the good thing about intermittent fasting is that you can drink a lot of water. So adequate water. Something I notice in people who do intermittent fasting is that once they start eating, that period when they're eating, they're not eating very healthy. So I would advise healthy eating during the period of time when you're actually eating. Healthy diet is important. This high carbohydrate binge also is not really great for heat related illness. So intermittent fasting as such, as the fasting is usually over the night
Yeah.
tolerated, I would advise that it be done for people who are of the age group who can handle it. Elderly, it is better to be careful because heat and eating and everything is hand in hand. So you have to be very careful. But hydration is the mainstay. So if you drink adequate fluids during this period, see, salt you can take, water you can take. So those things are adequate during the fasting period. We will be able to tolerate it. If you're ill, then maybe you can take a break from the intermittent fasting and recontinue it after your illness is over, like a viral or whichever small illness you're going through during that period.
By elderly, you mean after 60? Yeah? What is elderly?
See, there's no age cutoff like that. So it depends on fitness as such, and it depends on what your body can tolerate. So person with many illnesses, comorbidities, we call it, no, cardiac disease, diabetes, you have to be very careful when you do these type of things. Diabetes, I would say, don't do it. But people with many illnesses together, it may be more dangerous. While a person who has no illness, who is should be able to tolerate it well.
Thank you for answering that question and asking that question as well. Okay, Dr. Gina, can you tell us from a little bit of academic perspective, a lot of us in the healthcare group are here. So we wanted to know what are the appropriate tests and what would be the treatment if you see a patient, even in a small setting, in a small clinic, what can you do for a patient who comes?
Okay, so if a person comes in with, so now we're looking at, usually the patients come in with heat exhaustion and heat stroke. So when they come in with that spectrum, what is most important, especially heat stroke, is cooling the person. So let's say you're taking your relative to the hospital, you should not be astounded, or you should not get worried. They usually take the person into a room or an area where there is air conditioning. So usually into the ICU, where there is cool ambient temperature. Then the other things we do, we remove their clothing and put loose clothing or loose sheets, and we wet the patient and allow convection. So there's usually a fan which will circulate the air, which allows evaporation, which is the most useful form of temperature, useful way of bringing down the temperature in a person with a heat-related illness. So evaporative cooling is one of the best methods. Usually our patients will require an IV line. If you look at it in an emergency perspective, I'm an ED doctor, they start off by, we make sure they're breathing well, their breathing and oxygenation is okay, and we make sure that BP and pulse rate and all is okay. That and all we'll take care of. We usually put off an IV line, and through the IV line, we usually give cool fluids. So now there are two issues. One, the people who come may be old and may have multiple illnesses. So the amount of fluids and how we give fluids are watched, and we give it very carefully based on the patient or the person themselves and their clinical situation. So we give cold fluids. We try to bring the temperature down by evaporative cooling, and the ambient temperature around us is maintained at a lower temperature. Other things you might see people doing is, if the person is not responding normally, if the response is obtunded, then sometimes we put a tube through the nose, which we call an NG tube, and give cold saline through that. That also helps bring the temperature down. Now, when we put the IV line, quite often we send a bunch of blood tests. So we do blood counts, we do electrolytes, which are the sodium, salt, and potassium in the blood. We do kidney function tests. And then we do something called CPK, which looks at the muscle health. So all these things look at how bad the heat-related illness is. We also look at liver function. So basically, if the heat-related illness is very severe, it can affect the lungs, the heart, the kidney, the liver. So every organ can get affected if the heat illness is prolonged and not looked after. So we do tests to look at how bad it is, and based on that, our management or how we treat happens. Now, because heat stroke is one of many diagnoses for a person who comes with high temperatures, we must do workup for other infections. So quite often you'll see a urine test being done, a chest x-ray being done to make sure it's not some other infection. Sometimes your doctor may give antibiotics, which is because they are not sure if it's a heat stroke or an infection. Once they've ruled out all the infections, the antibiotics will be stopped, because in heat stroke, these antibiotics are of no benefit. So all these things may happen in emergency. Sometimes the doctor may ask you for a CT scan, or we may want to do a CT scan of the brain to see why exactly the patient is not responding or talking normally. But in a person with heat stroke, very often when the cooling mechanisms set in, the person starts to respond normally quite fast. So those type of things will help us in our diagnosis. So usually a person is maintained in an ICU, and all these mechanisms and treatments have to be started very fast, because if therapy is started and cooling temperature is brought down rapidly in the first 1 hour, the incidence of death or mortality comes down by from 30% to 15% because of fast cooling. So that's very, very important in our treatment. So all these things will be done when you take a person with heat-related illness to a hospital.
Thank you.
Okay, so if a person has been admitted because of any of these complaints to the hospital, and after they get treated and get better and get discharged, how do we follow up with them, be it their family or their doctor, like both of these people? How do they follow up with these patients after that? Is there anything special that they need to take care of, or something like that in patients who already
You said,
experienced?
how do we follow up with the doctor? And what was the other part? How do we follow up with I didn't understand the family part.
As the family of the patient who's been admitted to the hospital because of a heat illness, what do they do to take better care of the patient after an episode like this has happened? And what do the doctors do after an episode like this has happened?
So once the person is treated, which means temperatures have come down, they're back to normal activity. The sensorium, their responsiveness and all is back to normal. Usually we discharge them. And once they go home, we would advise that the ambient temperatures are maintained lower at home. They're hydrated well. and they take adequate rest and adequate healthy diet. Usually, if we discharge, we'd like to follow up and see how they are doing. So maybe the doctors would call the person back for review maybe in about a week's time to make sure that they are okay, their blood pressure is fine, heart rate is fine, they're responding okay, temperatures are fine. So usually you'll have to visit the doctor one more time just to make sure they are fine. The other thing is we would advise the relatives to keep an eye on the person at home, which means temperature mapping to make sure the temperatures aren't high, make sure they're passing enough urine, and to make sure that the activity there, they seem comfortable doing all their day-to-day functions. If there is any problem in any of these things, we'd ask them, any danger signs, we'd ask them to report back to hospital if required.
Right. Shall we take some questions from the chat box? So few people have said they've been through the same. Yeah.
If anybody
so
has a life experience to share, that'll be nice.
So one of the questions is, if we have juices with salt, can it aggravate blood pressure for a person who's a hypertensive and is taking medications for the same?
So in a situation where you're not experiencing heat-related fatigue, then you don't need to take juices with salt. But a person who's exerted or sweat a lot and there is a heat-related fatigue, then that, and you have like a heat cramp or heat exhaustion, then you might require to have some amount of fluid with salt. So in that situation, the body doesn't have adequate the circulation is compromised. So most probably the person's blood pressure will not be so high. It will be on the lower side. So even in hypertensives, you can have a person with a high blood pressure. You can have episodes of low blood pressure when you're dealing with a heat-related illness. So unless you have it, don't take salts prophylactically. Hydrate yourself, drink adequate water prophylactically. But once you've developed a heat-related illness, you'll feel it. Severe myalgia, muscle cramp, exhaustion, fatigue. Then you can add a little salt into your drink.
The next question is, what will be the health effect of heat waves on labor working? Basically, an open space person, especially women and children. So, for example, people working in brick kilns and anything basically to do with the manual labor. What is the health effect is the question.
So, most people who work, the manual laborers who work like this, they have what is called acclimatization. So, most of them over a period of time have developed. So, because the heat develops over days, their bodies have acclimatized to the ambient temperature. That doesn't mean that they can handle everything and anything. So, it's very important for these people that hydration is adequate, that they drink lots of water, and it's very important that they cover their heads, they have a place to go and rest. When do we see them come with a heat related illness? It's usually when there's a stressor, either a acute heat wave which is worsening, or they have a illness like a viral insult, and those type of things kind of precipitate a heat related illness in a person who is otherwise daily working in that ambient heat all the time. Because of this so-called acclimatization, their body is used to it otherwise. Now, as people who, if we can help those who are working in such environments, it's important to provide cool water, a place to rest with adequate shade and shelter, and if possible, cool water, loose like cotton clothing or absorbent clothing, which will not maintain the heat on them. So all those things will help them and help prevent heat related illness in such people. I think I saw a question on humidity. So I think as the humidity increases, the risk of heat-related illness is also more, because the sweating and evaporative cooling mechanism doesn't work as well. So it is a very risky thing. With temperatures and humidity, the heat-related illness increases because our evaporative mechanism of cooling is not as effective. Again, the mechanisms to prevent are still the same. Hydrate, rest, cool temperatures, cool water, cover yourselves. Don't wear clothing which preserves heat. All those we have to do to prevent heat-related illness. Women and children and everybody face the same end organ damage with respect to heat-related illness. So heat-related illness will still have that entire same spectrum, be it an adult, man, woman, older person or child. So they will all go through the same spectrum, and the Children are more susceptible, so they get sick faster. Their tolerance is less. The group of women which are more susceptible are pregnant women. Their compensatory mechanisms or the mechanisms to maintain the cool may not be as good. They already have certain changes in their body. With that, this heat may not be tolerated as well. So pregnant women have to be very careful.
Do you have any experiences, any shared experiences from the audience? Anybody, listeners? Any other questions, please? I think we've covered everything. It was a very exhaustive session. And really a big thank you to Dr. Gina for actually coming through for us. And here at Nirvana, we are really grateful for your
I
participation.
just have one question.
Yeah.
Is it important to use sunscreen? Is it imperative to use sunscreen when we go out in the sun?
It is good to use sunscreen. It's good for your skin. It prevents heat, sunburns. I don't know if it will not really prevent heat cramps and heat related illness, but it protects your skin from the sun. So it is very good to use sunscreen in heat related illness in summer. Actually, they say you should use sunscreen all weather.
Oh, okay.
But yes, in summer it protects your skin from the heat, sun.
There's a question about Rosa or Ramadan fasting, where you fast without any water or food for about 15 hours. So what is your take on that?
I think it's very, very dangerous. It's a religious thing and I cannot comment on that. But you have to be very careful in those situations. Working in the heat without drinking water is very, very dangerous. Those people are very, very susceptible. If possible, elderly people taking fast, please be in cool ambient temperatures. Stay in an AC room, exert less. That is safer. Younger people also, as soon as the fast is over, hydrate well. In the period you can drink a lot of water and try to maintain cool, because there are various mechanisms to maintain temperature, and if you're not able to take it internally, at least externally we should be able to do it, which is evaporative cooling and also ambient temperature, the temperature of the environment around us. So those type of things we should try to work on, manage with what we have. I think
Thank
I
you
saw a
so much.
question on the brick kiln. I just to reiterate, if somebody working at the brick kiln suddenly collapses or has like a fainting episode, see, one thing I want to tell, if somebody has a heat syncope or a heat fainting episode, lift the legs up because all the blood is pooled at the legs. So lift the legs up. Don't pour water in the mouth and all that. Just lift the legs up and wait for a few seconds. Usually the person starts to talk again. If they respond immediately, then just give them time. Don't try to make them stand up in a hurry or anything. Keep the legs up, allow them to be in lying position, let the blood circulate back into the brain because all the blood is sitting at the legs. Once that happens, the person will regain consciousness and talk to you. Once they talk to you, you can slowly prop them up. Don't give them water in lying down position. Please give them water sitting up. Allow them to hydrate lots. And then after that, you can slowly prop them up and get them to go and sit in a place which is cooler. Once their temperatures are down and if they are okay, probably let them rest and go home, but may not need a hospital if they're back to normal activity. If for an hour you've made them rest and you still feel they don't look good, please take them to a hospital.
Okay. So I think if anyone has any more questions, you can always write to us on our email ID. And thank you so much for taking out the time to answer all of our questions and telling us some. I think after this, we know that there are a few simple things that we can do to prevent something as serious as a heat stroke. So I think enough hydration, putting on sunscreen to prevent sunburns, covering yourself when you go out directly in the sun, and in case anything which we're not sure of or we see people fainting, then I think the best thing to do is going to the hospital and take help there. So yeah, so thank you so much for talking about the very relevant and important things that are going around these days and clearing all of our doubts. And yeah, if anybody has any more questions, you can write to us on our email. Yeah, thank you so much.
Thank you. Thank you, doctor.
Thank you.
Thank you. Thank you everyone for joining.